Oh, are you
So
recording now, Jose?
yes,
Hello?
yes, yeah. I'm
Okay.
gonna start recording, but because I'm gonna ask you 3 or 4 questions, so we can, in case we need to go back and review your answers. I'm sorry.
Perfect. No, that's okay. So the other area that I think it would be very interesting to explore, if that's something that you would like to do, is hepatitis. I don't know exactly. There are different task force out there. They're doing hepatitis. There's the Hepatitis Coalition Group. And for us, it's very important just because we have Southeast African, Southeast Asian communities that are affected by either hepatitis B or C, and also because of the baby boomers increasing in amount. I think trying to make sure that everybody gets tested for hepatitis C. Also, we're right here by the border, as you said, and that's something that we don't have the same precaution in countries outside of the United States. Maybe not everybody has the hepatitis B vaccine available.
Mhm.
So, in religious practices in general have influence for these particular diseases to be a little bit more prevalent in this population. So I don't know if that's something that would be interesting for us to talk about. And it just came to my mind because within hepatitis we have a liver group that also looks at the diabetic patients and how the diabetes affects the liver for the diagnosis of NASH, non-alcoholic hepatitis. So all that put together, just an idea.
No, and this is great feedback. Um, we are going to definitely include some of the Hep C activities. In fact, February 14th, we have a webinar. One of the subject matter experts in Texas is talking about Hep C and the new treatment recommendations, and
Hmm.
she's going to talk about, she's going to give a general overview of the disease, but this is
Who
specifically
who is? I'm sorry. Who's going to be giving the overview?
uh, the name of the doctor is Minta Jain.
Hmm.
She is with the South Central AIDS Education and Training Center, and
Okay. Yeah. No. I don't. Hmm.
she is going to be presenting. So I will send you the link in case someone at La Maestra wants to participate. But definitely, we can also explore the possibility of including more Hep C activities. That's something that we can definitely do. In fact, not only grantees but also HERSA is very interested in viral hepatitis in general.
Yeah, I think it would be very important because we I'm noticing a lot of resistance from the health plans to approve to pay for certain treatments, which I think is nonsense because, in 12 weeks, I know the treatment is not the cheapest thing on the world, but in 12 weeks, we can have a patient there is a 90% chance of cure. And before we can get that medication approved, we have to spend months because it takes sometimes months to get it approved. Although with Maverick now having medical kind of pushing that medication, which is a wonderful medication. We don't even have to do any kind of genotyping for the patient.
Mhm.
But, how can we create enough awareness that all the providers, and it's very user friendly by primary care providers. They don't need to send the patients to a specialist unless the disease is already advanced. So I think that will be something that we can talk about and see
Okay.
how we can, you know, learn from each other.
Okay. And even if we can we can do a couple of activities, include that as one of the learning collaborative activities, and discuss Hep C, or hepatitis, viral hepatitis in general, with a focus on hepatitis C, or do a webinar and invite health centers. Like I know that you at La Maestra are doing lots of things on viral hepatitis, including when I talked to Zara, we talk about the use of telemedicine and things like that. So I believe
Hmm.
that's something that we can also include. Thank you. This is really helpful. Thank you, Sonia. And
Hmm.
let's see. I would like to ask you a couple of questions now and get into the cervical cancer screening. Um, I believe that we scheduled this call for 30 minutes, and I want to be very respectful of your time.
Hmm.
Um, so, in regards to cervical cancer screening, Sonia, we are trying to find out the primary prevention strategies that you have at La Maestra. For instance, if La Maestra provides sexual educations for boys and
Hmm.
girls, or the
Hmm.
use of, or they promote the use of condoms for safe sex.
Hmm.
We also talk about vaccination the other day. So,
Hmm.
what prevention strategies does La Maestra have in regards to HPV infection and STDs in general?
Hmm. Yeah. So what, as part of Title 10, one of the things that we have been working on is making sure that our education protocols are strong and are used effectively, uh, especially not only in the general population, but since we have a clinic in a high school in our teen population. So creating awareness, making sure that the patients have the correct information, that when they are choosing a birth control method, they know exactly what they're choosing and what the positive and negative effects could have, and what else can they use in order to prevent not only an undesired pregnancy, but also any kind of STIs or, in this case, HPV infections.
Mhm.
So it's something that we embark in this journey. So we've always had a protocol and we've always had a curriculum that we have taught. But last year was a very involved. In fact, as we talk, I'm preparing for the Title 10 biannual information that we have to send to their offices. So trying to make sure that everybody is aware and they understand what their options are, and not only is about preventing an undesired pregnancy, but also educating how is that being sexually active could influence in your life, basically.
Mhm.
So we have a whole health education department that has been trained, and we have 6 people that are ready to educate whoever it is that needs education or reinforcement. We have a team provider that has been very well involved with the Title 10 idea in making sure that we provide the support that those patients need, and
Mhm.
also our OBGYN department. I'm not saying that it's not, that the primary cares are not involved, but we really want to make sure that we have a provider champion. And we have one particular provider champion that also sees adults and sees pediatrics. So she's a good link for our primary care providers to send patients to in case that they need an extra education, an extra holding hand for the patient.
Now, do you work with the community organizations to do some kind of sex education, for instance, with the schools, or do you do any kind of health fair? And when there is the opportunity, you educate the patients, or this is done in the clinical sites?
Okay, it's done in both. It's done in the clinical side, and we also work with the different organizations that work in the schools, especially in the high school and in the middle school. So we have one middle school and we have one high school, and we also partner with the school district. So we were part up until last year. The nursing portion of the school system here in San Diego had a coalition group, and we were going and being part of HIV training, sexual education, and one of our health educators was attending to the meetings in monthly basis and also going to the different schools and participating with the health educators from the schools to make sure that we were giving the right information to the patients. It's not only on the clinical side, but it's also on the partnership in the partnership with other agencies that are working on the same topic.
Okay, okay, okay. This is excellent. Now, if there is any additional information, or if there's any, or if any of these young patients is interested in being tested, sometimes they are afraid of asking these questions. Uh, do you have any process to follow up
Mm-hmm.
with any of these adolescents who may have additional questions?
Oh, absolutely. So that's when our team provider comes in play, because she is at the school, so she's able to communicate and she's able to meet one-on-one with the patient and
Mm-hmm.
make sure that we have a constant education to our ancillary staff, making sure that they understand that these patients have right to privacy, because this is one of the areas that is protected by California law.
Mm-hmm.
So they're able to come to us and we educate them and we make sure that they know that if they're 12 years and older, this is information that we're not going to give to their parents, and we have different flags within our EHR system when the patient comes for those particular appointments. So we make sure that nothing is billed out, nothing sent to the patient's home. We don't call the patients because sometimes, especially 12 years to 16, 17 years old, they could have the parents' phone number within the chart, and we
Mm-hmm.
flag that particular chart so that we don't send any information to the parents.
Okay, okay, okay. That's fantastic. This is really good. Thank you, Sonia. Now, I would like to move on and talk a little bit about secondary prevention strategies.
Mm-hmm.
And probably the best way to ask you this question is by providing a case studies example. And if you have a patient who goes to the clinic for the cervical cancer screening, and the result comes back positive for a pre-cancerous lesion.
Mm-hmm.
What are the next steps? How do you inform the patients, and what services do you offer?
Okay, so what we do in that case is we bring the patient back to meet with the provider. So it's usually in the OBGYN area. The
Hmm.
OBGYN provider spends time educating the patients and making sure that they know what we're talking about, especially if it's a pre-cancerous lesion, not necessarily cancerous, but it's abnormal. And then we make sure that our patient navigators and our case managers will take the case. We send the patient. So there are uh, different protocols that could be applied. So we can either do a full biopsy right there so that we can confirm the diagnosis, or if we are sure of the diagnosis, we'll make sure that the treatment is provided for the patient, or it will be up to the provider to send the patient to a specialist if that's what the patient needs. But that patient has a case manager and a patient navigator that will hold their hands through whatever it is that they need to do. And if instead of being a precancerous lesion, it is a confirmatory cancer that needs treatment, so we make sure that we send the patient to the proper area where they need to be treated.
Okay. And what treatment options do you have in place? For instance, not only for screening, but sometimes to treat any abnormal lesion. Like, do you have a colposcopy service in
Yes.
place? Okay.
Yeah. Yeah, it will be up to the provider, but it's usually they usually do a colposcopy. We have three providers, I believe, that are trained to do colpos, and we have slots in specific times where they're booked only for colpos, so that we ensure that the provider is well trained, and they go back and they make sure that they keep the knowledge and the training up to date on colpos.
Okay. which makes me move to the third question in regards to now tertiary prevention. And if you have a patient who, after going through all these process, is determined that the patient has cervical cancer and
Mhm.
probably invasive cervical cancer, and you have to refer the patient to a more sophisticated facility, what
Mhm.
are the referral mechanisms that you have in place?
Oh, we have at that one. I can say we can pride ourselves to say we have a wonderful referral mechanism. So, well, first of all, we know which areas or which organizations will be able to take our patients depending on whether the patient has a managed care plan, or if we have to help them qualify for any kind of emergency coverage for cancer treatment.
Mm-hmm.
And that for that we also have somebody that takes initiative and is very very well versed on how to help the patient to make sure that the patient gets the right coverage for us to be able to provide the opportunities for treatment for the patient. And so at that point, the provider will set and start referral to the referrals team. Our referrals team is very very well versed on where is going to be the faster, easiest, and more compliant place for us to send the patient. Depending on the zip code of the patient, we are able to link them to the specialist that will be able to treat the patients. And then our patient navigator or case manager will call that particular area directly herself if it's needed. So we will have to stratify how important it is. If it's an invasive case, we want to get the patient in as soon as possible, and we're able to expedite the process as needed as well.
Okay.
And then that case manager also follows up with the treatment. And we try. It's not easy to try to get feedback from the oncologists that are treating these patients, but we definitely try everything that is in our power to make sure that that we know what treatment the patient is on, because we are their primary care providers, their medical home nonetheless. So we want to make sure that the patient comes back to us for everything else that is not necessarily related to their cervical cancer.
Okay. Now, and the last question, even though I don't have that question written here, is out of curiosity. You are in a geographic area when you may have some immigrants that probably are
Mhm.
uninsured,
Mhm.
because some patients have Medicare or Medicaid or private
Mhm.
insurance. Is there
Mhm.
any state program helping those uninsured if they have any of these cervical cancer issues that we mentioned?
Yes. So every woman count has an arm for when, and I don't know exactly how that one works. That would be more my case manager, the one that will help us answer exactly how that works. But when a cervical cancer screening or a patient that had a pap smear or a mammogram done, and it was positive for cancer, there is an arm that if the patient is uninsured, we're able to help them with some kind of coverage, so as long as we can prove that the patient needs the treatment. So
Okay.
and that is part of Medicaid.
Okay. Okay. So it's part of Medicaid. Okay.
Hmm.
Excellent. Excellent. All right. Well, Sonia, thank you so much for this information. And it's always a pleasure for me to talk to you and learn all the good thing that La Maestra is doing for the population that you serve. So thank you. And I will keep you posted on the other topics, and I'll
Hmm.
send you the information about the conference.
Perfect. Well, thank you so much, Doctor, and it's a pleasure talking to you as well. And I look forward for our next round call. And I'm so sorry I couldn't be in the last one. I had an emergency meeting, but I really enjoyed the call that we had a few months ago.
Okay, excellent. Thank you so much. Okay, and have a great
Thank you.
day.